In this video, we will teach you how to change your child's GTube. This is the new Gastrostomy Tube, or GTube kit, that will arrive in the mail. The Halyard, now Avanos manufacturer, calls it a Mickey button. You may also have an AMT manufactured GTube called a Mini 1 button. The first gastrostomy tube change is done in the clinic with your provider team who place the tube, such as pediatric surgery or GI. It is important to bring your new GTube to your first clinic visit. After that, families should replace their child's GTube at home about every 3 months or when you get a new one in the mail from your supply company. First, gather all your supplies. Supplies include your new GTube set, which comes with extension tubing, syringe, and gauze, water-soluble lubricant, and water placed in a cup. Also be sure to have your emergency Foley tubes ready. These are the steps to changing your GTube. 1. Check your new GTube. Make sure it is the right size. It may say 14 French 1.0 centimeters. The 14 French size is the thickness of the tube, and the 1.0 centimeters is the length of the tube that may change as your child grows. Let your provider know if the tube is becoming too tight, where it is difficult to turn the tube, and then they can order a longer tube. Now check the balloon of the GTube. Inflate the balloon with 5 ml of water. This can be tap water. By connecting the syringe to the balloon port and pushing down on the syringe plunger. Hold the plunger down or else the water will come back out. Hold the plunger down and twist the syringe off the port. Check that the balloon stays inflated and that there are not any leaks. If it looks good, deflate the balloon by attaching the syringe again to the port and pull back on the plunger until you see a bubble of air. Continue pulling back as you twist off the syringe. This will vacuum seal down the balloon, making it easier to insert later. Now, just leave the new tube to the side, dipped in the lubricant. It's ready to go. Two, deflate the balloon on your child's GTube by attaching the syringe to the balloon port and pull back on the plunger. Again, pull back on the plunger until you see a bubble of air, and continue pulling back as you twist off the syringe to vacuum seal the balloon down. If you only have one syringe, empty the syringe and let's get it ready. Fill the syringe by dipping the syringe in the cup of water and pull up 5 ml of water. 3. Remove the old GTube. Have your gauze ready in case food or stomach juice comes out. If your child ate recently, you may see a small fountain, but don't be concerned. It is normal and not dangerous. Just cover the GTube hole with the gauze to prevent a lot of leakage. 4. Replace the new lubricated GTube in a straight down motion into the opening. If you are having difficulty, hold the tube lower down on the stick part of the tube. This will keep it from bending since it's so flexible. Once the tube is in, hold it in place and connect the syringe to the balloon port. Push down on the plunger and fill the balloon with 5 ml of water. Just like before, hold the plunger down or else the water will come back out. Hold the plunger down and twist the syringe off the port. 5. This is the most important step. Always check placement before using your new GTube. Attach to the extension tubing by lining up the black markers and twisting the attachment on. Look for spit, food, or stomach juice. If you do not see anything right away, it may have been some time since your child ate. If this is the case, use a syringe and attach it to the extension tube. Pull back on the plunger and move your child side to side to try to get some stomach juice out. Once you see spit, food, or stomach juice, you can feel comfortable that it is placed correctly in the stomach, and you can use your new GTube. I recommend doing the change about an hour after a feed so that their stomach isn't too empty. It's then easier to see food and check placement. If you have any trouble placing the G-tube, insert your emergency Foley tube. Start with the same size emergency tube as your G-tube. For example, start with the 14 French emergency tube if you have a 14 French G-tube, since it is the same size thickness. Lubricate the tube by dipping it in the water-soluble lubricant and insert the tube about a finger's length. You can mark the tube with a pen before putting it in. Tape the tube in place and tape the tube opening closed. Call your doctor to come into clinic or the emergency room. If you cannot get this tube in, use the skinnier tube, a 12 French if you have a 14 French G-tube. It is important to try to put something in the G-tube hole to keep it from closing. Call your provider as soon as possible. Most importantly, do not feed your child by mouth or through the tube until you are seen by a provider. For regular maintenance, remember to clean around the G-tube daily with water and soap. Your child can take a bath 2 weeks after the surgery, and before that, just a sponge bath. Keep the site dry with a gauze or dressing that is changed daily. Clear mucus is normal. Remember to always carry your emergency Foley tubes with your child in the event that the G-tube comes out. Please call if you see the following: scar tissue or granulation tissue. It isn't dangerous and it just secretes mucus or can sometimes bleed. It can be treated with steroid cream or silver nitrate with your provider. G-tube site leakage, and if your child's skin is becoming irritated from the moisture. Signs of infection, such as pus, fever, pain, or redness around the site.